Hello, my name is Olivia Hager, and this is my research proposal on play therapy on an ADHD changing brain. What is ADHD? Attention Deficit Hyperactivity Disorder is a brain disorder with a constant pattern of hyperactivity, impulses, and inattention that interferes with the function and/or development. According to the National Institute of Mental Health, the symptoms of ADHD show up as early as elementary school, ages 3 to 6, and continues through adolescence and adulthood. And these are the 3 types of ADHD: inattentive, hyperactive, impulsive, and combined. Inattentive is procrastination and forgetfulness and hesitation, second guessing a lot, and you're a little bit more calmer. And then hyperactive and impulsive, you have problems paying attention, excessive activity, and difficulty controlling behavior. And combined is procrastination, problems paying attention, excessive behavior, hesitation, and all of that just put together as one. Background information. The neuropsychiatric EEG-based assessment aid system, NEBA, can help calculate the theta-embedded brainwaves that are significant in adolescent children with ADHD. The data collected helps by placing children in an appropriate ADHD group: inattentive, hyperactive, impulsive, or combined. The NEBA equipment uses a special stick-on electrodes to collect that data. NEBA is based on an electroencephalogram EEG, which is another way of measuring electrical brain waves. Family therapy is an important part in treating ADHD patients. Family therapy allows for the family to learn how to deal with certain symptoms before and how to maintain equilibrium in the household. Children who end up doing therapy rather than stimulant medication progress faster and can produce long-lasting effects. Play therapy is more appropriate treatment to treat children with the ages of 3 to 11 years old that promotes communication in child's natural language, which is play. What is happening in the brain? The frontal lobe is one of the areas where ADHD is implicated. Frontal lobe is involved in memory, impulses, control, attention, and a few more responsibilities. When your brain is developing, when you have ADHD, the frontal lobe may develop a little slower and appear to be a little smaller. The prefrontal cortex is implicated in a variety of behaviors that include planning, personality development, perception, and other complex behaviors. The PFC is the intersection where all judgment, attention, behaviors, and emotional responses operate, but in ADHD, a patient that intersections is unregulated, causing for various thoughts going in and out instead of it being regulated thoughts that are controlled. And the 2 neurotransmitters that are involved with ADHD are dopamine and norepinephrine. Dopamine projections to the mesocortical areas mediate prefrontal cortical processes that enables the suppression of distraction and inhibit inappropriate behavior. When dopamine pathway is in overdrive, it causes an impulse behavior in response. Norepinephrine has been shown to play a major role in one's mood and attention. Low levels of this neurotransmitter can make it difficult to focus. Since norepinephrine can function as a hormone and neurotransmitter, when functioning as a stress hormone, it affects attention. Methods. Participants. 50 elementary school students from ages 6 to 12 will be participating in the study. An email was sent out school-wide to all parents to participate, asking if they would like to participate in the research study that involved a neuropsychiatric EEG-based assessment aid, NEBA, which helps diagnose ADHD. The consent form will also have a link to the NEBA and how it works and the procedures. If parents still want to continue with the study after reviewing the NEBA, it will be directed to a rating scale called the Children's Symptoms Inventory that screens for emotional and behavioral symptoms of childhood disorders for both parents and teachers. The information from the inventory from both parents and teachers will be reviewed by researchers and counselors to match symptomology with ADHD. The children's symptoms inventory is basically getting information from your parents and your teachers and putting it together to see how you act at home and how you act in school, and then see where that places you. Procedures. After consent is given, parents are instructed to complete a children's symptoms inventory. That should take 12 minutes. Participants will be sent down to do the NEBA, which will take about 15 to 20 minutes. That's where they will be connected to electrodes, invasive, non-invasive electrodes on the brain. And participants will then be randomly assigned to 2 groups, play therapy and reading monitoring. And the sessions are 7 sessions that last for 7 weeks, or about 30 to 45. And this is an example of the neuropsychiatric EEG based assessment aid. And theta and beta waves are the ones that we look at when we look for NEBA. Theta waves is where children with ADHD might find themselves more often because it's associated with the states of enhanced creativity and learning, deeper relaxation, stronger intuition, problem solving, and daydreaming. The beta waves are decreased fast waves, and we're trying to shift away from the theta waves and gain more focus. Beta waves use more hyperactivity to get them at the median. Beta waves are the highest frequency and is the normal state. Procedures continue. Play therapy is a developmental process that is used to meet the social and emotional needs of children. It offers the child the ability to communicate feelings through the language of play. Counselors will be using centered play therapy, CCPT, to help facilitate the session, and during the play session they will also be using play therapy skills checklists that will be filled out to help categorize the nonverbal and verbal responses and be able to place the students in different verbal categories. And then the other one is reading monitoring, and reading monitoring is used as a controlled environment for students that are in the group. The counselor picks the books and helps when needed. The counselor gives the child an option to read to the counselor or counselor read to them. The counselor should pick out age-appropriate books for each individual child. Counselors are able to help with pronunciation of words, but to only focus on reading and not to be derailed by other things outside of reading. Each session is 3 times a week for 30 minutes. Counselors are facilitating the reading session by directing the student's activity. The counselor picks the books and helps with the reading as needed. Future implications. Neuropsychiatric EEG-based assessment aid system is fairly new, and it's quick and easy, and it's easier than an EEG, so I feel like that will very progress in the future. Play therapy, because is a strength because you're not stuffing the child with medicine, but you're actually helping and trying to develop the brain by using play and interactions. And so weaknesses will be the duration of the study. The study lasted not too long, and I don't think that there will be much difference from the beginning of the study to the end of the study. Thank you, and these are my references to the